begin, Dean. And I want to introduce Susan Kohler. She is going to be the moderator of our panel on COVID-19 whistleblowing. She is a partner at the Halunen Law firm in Minneapolis, one of the firms in National Whistleblower Center's Cooperating Attorney Network. And given Susan's deep expertise in helping whistleblowers in both False Claims Act cases and employment law cases, I can think of no better person to help us think through how whistleblowers can contribute on the COVID-19 crisis, how we can support whistleblowers with this enormous priority. Susan knows quite well how whistleblowers achieve justice in exposing fraud and in protecting themselves from retaliation. So Susan, I want to thank you for joining us and helping out today, and I'll let you take care of introducing the panel.
Thank you very much, John, for that kind introduction. And I'm very happy to be here. As an attorney at Halunen Law that represents whistleblowers in both retaliation and false claims matters, I am honored to introduce the panel here today for you on the role of whistleblowers in relation to public health and economic revitalization. With COVID-19, the work of whistleblowers hits close to home for everyone. We all are potential victims of the virus. We all suffer the economic impact of dealing with COVID-19, and accordingly, we all are dependent on the courage and the commitment of whistleblowers and those who work with them and protect them, three of whom I will introduce to you as panelists today. Our first panelist, Jhonna Porter, is a charge nurse at West Hills Hospital in Los Angeles, which is owned by Hospital Corporation of America, one of the largest for-profit healthcare providers in the world. Ms. Porter is an active union member of SEIU 121RN. Shout outs to them. She will tell you her story about the retaliation she experienced trying to protect patients and coworkers in the course of the pandemic. Jhonna Porter will be followed by Michael Horowitz, whose picture I'm not seeing yet. I'm hoping he's here.
I'm on.
He is the Inspector General. Sorry? He is the Inspector General
I'm sorry, it's Michael.
Department of Justice, and he is also the acting chair of the Pandemic Response Accountability Committee, I think called PRAC, created by the CARES Act to conduct oversight of the $2.4 trillion allocated to economic recovery related to COVID-19. Now that's a job. He will discuss the importance of whistleblowers in ensuring that these dollars actually contribute to our recovery. And the final speaker will be a protector of whistleblowers, Henry Kerner, Special Counsel of the U.S. Office of Special Counsel. The OSC is an independent agency with the mission of protecting federal employees from prohibited personnel practices, and especially reprisal from whistleblowing. We will learn from Special Counsel Kerner about the types of cases OSC is seeing as a result of COVID-19. And so let us begin with whistleblower Jhonna Porter. Welcome, Jhonna.
Thank you for that introduction, Susan. I'm a relief charge nurse, which means that I'm responsible for supporting other nurses on my team, essentially during battle. And that's exactly what it's been like to work in a hospital during a pandemic. And when nurses are understaffed without enough PPE, as they are at my hospital, it's like going to war with a hand tied behind your back. I feel a need to protect my coworkers, my patients, the public, and my family. The instinct is the very thing that drove me to become a nurse in the first place. It's also what moved me to speak the truth so that people I care about will be safe. I never set out to be a whistleblower. I certainly never expected that I'd be the focus of media attention or on a panel like this one. But however we got here, I think we all share one thing in common. We hold the truth, and the people in positions of power with something to hide don't like that. In my case, telling the truth got me suspended and almost got me fired. And the promotion that they had offered me prior to this is suddenly off the table. If I had to do it over, I'd do it exactly the same way. I work at West Hills Hospital, which is owned by the Hospital Corporation of America, the largest, wealthiest for-profit hospital corporation in the nation. HCA is a giant in healthcare, and they're powerful. They're also very concerned about their public image, which is something that I learned the hard way. When management decided overnight and without warning that all the COVID patients would be moved to our floor, I sounded the alarm so that my fellow nurses could be prepared. We already didn't have enough PPE, and now we're going to be working at ground zero, where we'd all be potentially exposed. I wanted my coworkers to be safe, so I posted a message to a private Facebook group that we use at work, where only members that are people that we work alongside me in the telemetry unit. I told them what was happening, which room numbers the positive COVID patients were going into, and to be ready for it. This was around March 19th. On March 24th, I publicly posted on Facebook, my personal Facebook page, about the lack of PPE and asked for donations from the community to be given directly to nurses, not to management. I said, I need anything I can get. Thank you for everyone for praying for our staff and donating and what they can for nurses. The same day, an ER nurse wrote on his Facebook, our administrators are not giving out masks unless patients are suspected of COVID, but that's not acceptable. By then, we'd already been exposed. So please donate to someone you know in the medical field. The next day, they put us both on suspension pending investigation. That wasn't easy, as they ghosted us for 10 solid days during a pandemic when they need staff. Instead of crawling into a hole and staying quiet at home, I decided to speak up. I did interviews with Bloomberg, Vox, LA Times, New York Times, was on CBS News, and more. Somehow I even ended up on Dr. Phil, who was particularly upset about whistleblowers being silenced. You never know who's going to be on your side. In the end, I was called back to work, but not with open arms. They stated a month later that they let me come back to work because I'm a great nurse, yet also called me a liar and asked why I didn't use my platform to make them look good. For now, I'm back at the bedside, not made charge nurse much anymore. In fact, there's a directive not to make me charge nurse anymore. Yet I'm still speaking up for safety, and I've been told there's a big target on my back. Intimidating nurses so they don't ask for help from their community does not flatten the curve. It only makes the situation worse. HCA is still doing that. They're retaliating against others who speak out against unsafe conditions in their hospitals. My union, SEIU 121RN, put out a petition to the California Attorney General telling him to stick up for HCA employees who go public with the truth. You can find that petition at bit.ly/AG-whistleblower. The link will be in the chat. If you want to support us, please sign the petition. In a public health crisis, telling the truth is a life-saving act, and we must do it no matter what the risks are. I'm going to keep doing that. I encourage all nurses across the country to do the same and to not be afraid of their employer. This is what we need to do. And thank you for having me on, and I appreciate it.
Thank you, Jhonna. Your story is unfortunately one that we've heard a lot, and we applaud your courage in speaking up. We're going to move on now to Inspector General Michael Horowitz, who, as I said before, is the acting chair of the Pandemic Response Accountability Committee. Mr. Horowitz, are you here?
I'm here on the phone. We have been unsuccessful getting my camera to work, even though the camera on my computer, my laptop shows it's working. So I apologize for that. It worked during the tests. But it is great to be here. I'm glad you can at least hear me. And I can see all of you. So I'm glad to be part of this event, which is always a great event to be part of. I am happy to offer a few words about where we are in the pandemic relief oversight efforts. We're dealing as a community with $2.5 trillion so far that has gone out the door. And we're dealing with a healthcare crisis that Jhonna has spoken to, about the issues facing workers, healthcare professionals across the country, issues facing federal employees, challenges in many different areas in our oversight responsibilities. upwards of 40 or so IGs have responsibility over funds that have gone to the agencies they oversee. And our eyes and ears are going to be the whistleblowers that need to come forward, and it is critical that they come forward and feel comfortable coming forward to report to us about abuses, whether it's in regard to the $2 trillion plus that has gone out the door, whether it relates to the healthcare challenges that our hospitals and other healthcare professionals are facing. We need folks to come forward. And that's why in the IG community and working with Henry Kerner and his folks at the Office of Special Counsel, it's been so important for us to ensure that whistleblowers feel comfortable coming forward. I certainly echo the comments of Senator Grassley, Congresswoman Spire, who've been leaders in these efforts. It has been a challenging situation with regard to whistleblowers. As you know, last year, the SIGI community sent a letter to the Office of Special Counsel about its decision in connection with the Intelligence Community Whistleblower Protection Act, the importance of encouraging whistleblowers to come forward, not discouraging them, ensuring that complaints get to the right place. What we've done on the pandemic committee, and if you go to pandemic.oversight.gov, you'll see our website. We've created a hotline specifically for pandemic-related issues. We've also created a series of dynamic web pages so that the public can see how the money is being spent, where it's going to, and that's something we'll continue to push forward for the reasons Senator Grassley mentioned about the importance of transparency and accountability. The public has a right to know how its money is being spent. The public has a right to know whether the money is going to the right places, and the public has a right to know what the outcomes are. And our eyes and ears on the ground are all of the employees, all of the people who touch those funds, who are the healthcare professionals, who see what's going on, and we're going to do everything we can to continue to support their efforts to be able to come forward to us as an IG community, and so that we can undertake the oversight that we need to in regard to this pandemic. So it's great to be here. I'm sorry I can't be there in person or by video, but it's always enjoyable to be part of this group. Thank you, Susan, and I want to thank the Center for putting this together in this virtual forum this year.
Thank you so much, Inspector General Horowitz. We'll have a few questions for you after we're finished hearing from from Special Counsel Kerner. So would you like to speak now, Special Counsel?
Of course. Thank you, Susan, very much. Wanted to say I really appreciate being invited to participate today. I'm reminded that I actually spoke at this very event in 2017 while I was still just an appointee and had not yet been confirmed. So I've always been very interested in coming to this event, and obviously I appreciate the Center for putting it on in this virtual format. I also want to reach out and thank you to Ms. Porter for her courage in speaking out, and to Michael Horowitz. The IG community and SIGI specifically, and Michael specifically, have been incredibly important allies in our efforts to protect whistleblowers and to make sure that they know that we're a safe channel that they can come to and bring knowledge of various violations to bear, and that we're going to protect them. We're going to protect their anonymity if they wish, and also make sure that we try to get the best results. And so I wanted to say a few words about how COVID has impacted the Office of Special Counsel. Like most workplaces across the country, 2020 has been a challenging year for us at OSC. Obviously, we've had to contend with the pandemic. We've also experienced mounting civil unrest across the country. And yet, in the face of these strong headwinds, we have nonetheless managed to continue our service to federal whistleblowers by ensuring the expeditious processing of whistleblower complaints. Now, overall complaints have been somewhat down this year, but we have exceeded our targets for how many whistleblowers we have helped. Last quarter, so that's the period from April through June, while our staff were subject to precautionary mandatory telework, OSC has obtained the highest number of favorable actions. Sorry about that. sorry, I had to close out. Anyway, we've obtained the highest number of favorable actions in our history, and of 105. And so we're on track to exceed last year, which already was our highest number of favorable actions with 303. So I'm very proud of the productivity. Obviously, when you're a manager of an agency during a health pandemic, one of the main things you're focused on is the health and safety of your employees. And so we wanted to make sure that our employees' health is taken care of. We went to mandatory telework very early on. We also have, we're in the sort of phase A return to work, but phase A really just means there's very few people here. There are obviously protections in the office itself, but you really have to make sure that not only are you still are you protecting the employees, but you're also getting the work done for the whistleblowers and the stakeholders. I'd like to share a few examples of our actions in response to the pandemic. So we got our first COVID-19 related whistleblower disclosure on February 27th, and we've seen a rise in the number of health and safety disclosures from federal employees since that time. So in response, I established an internal coronavirus task force to facilitate communication and bring significant resources to bear across our multiple units handling COVID cases. With the diligence of its members, OSC's coronavirus task force has succeeded in swiftly assessing COVID-related disclosures to ensure rapid referral for investigation of appropriate cases. While most of our intake initially consisted of disclosures of health and safety risks, and we're talking about the things that Ms. Porter talked about, for example, insufficient PPE, lately, we have seen more of an uptick in retaliation cases. So to date, our OSC task force has received 73 whistleblower disclosures and 92 complaints of prohibited personnel practices related to COVID-19. Now, one of the things the COVID task force has really excelled at is trying to achieve what we call course corrections or quick corrective actions, where OSC attorneys have intervened early to put the parties on a better path before more significant harm developed. Especially right now, it can be life-saving to give an immunocompromised employee safer working conditions or help a parent obtain much-needed leave from his or her employee. Now, in addition to the recent influx of COVID cases, we've had other disclosures related to health and safety, which have resulted in improved aviation safety, better care for veterans at VA hospitals, and safer workplaces. From improper EPA lead-based paint inspections to VA patients exposed to asbestos at medical centers, OSC has worked with whistleblowers to protect vulnerable Americans and federal workers. And that's the important thing. We have tried very hard, even in the pandemic, to make sure that federal workers know that we're there, we're going to support them. We've asked for filings to be electronically, where we have a Form 14 for folks. And I've been very proud of the work that the people here at OSC have done under very difficult circumstances and really achieved unparalleled success working with whistleblowers and agencies to address and prevent fraud, waste, and abuse. And with that, I'll turn it over to you, Susan, and thank you again for letting me address.
Thank you so much, Special Counsel Kerner. We have received some questions, so I'm eager to let the panelists continue to share their experiences with us. We've received a question from an HHS whistleblower commenting on the difficulty it is in the current environment to blow the whistle, given sort of the lack of support in the executive side of the government, the slowness of processes sometimes, and the fact that there's no MSB PB in place to address appeals. Perhaps both IG Horowitz and SC Kerner can respond to this. Are there efforts to address those issues, to fill those gaps, to expedite the resolution of the claims brought by whistleblowers?
So Michael, I'll start. Obviously, not having an MSPB is a problem. I completely agree. The OSC, as we obviously go to the MSPB for several things. In fact, I'm sure many in the sophisticated audience know this, but OSC was part of MSPB. In fact, my official title in some government documents is still Special Counsel of the MSPB. So we really need a board to validate a lot of our actions. Finality is one of them. Getting stays granted is another. There are some nominees that are currently pending in the Senate. In fact, there are three for the three members of the board. I do not know at this point if the Senate's going to take action on them and confirm them, but they are on the Senate floor, so they could be confirmed pretty much any time. As for the first part of the question, as an independent agency, OSC really tries to very hard to keep that independence, and regardless of who may be in the executive authority, whether the president's a Democrat, Republican, we're independent of that executive, and so we will protect whistleblowers. We have statutes that protect anonymity, and we will protect whistleblowers against any kind of encroachment and provide what I called earlier the safe channel to make sure that people know they can come to us.
Thanks. Mr.
Yep.
Horowitz, would you like to respond?
Yeah, I completely agree with everything Henry just said. I think you will, what's critically important here for the IG community is to do what I think we have been doing and will continue to do, which is to follow the law, to not be deterred in taking the steps that as IGs were required to take. You see that at the HHS OIG and the reports they're putting out. You saw that with the actions taken by other IGs, including IG Atkinson, in following the law as he was obligated to do. We continue to work with Henry and his staff on whistleblower matters. We took an oath to follow the law, uphold the law. And whistleblowers need to know that when they come to us, we will carry out our duties. I know sometimes it takes longer than we'd like. These are complicated matters often. We need to get to the bottom of them. They need to be thorough. The last thing we can have happen is that we get accused of doing shortcuts or doing something quick and a slapdash effort in some ways. So we're going to have to be thorough. There needs to be an MSPB, as Henry said, to handle these issues. But whistleblowers should know that the IG community is working closely with the Office of Special Counsel on matters that come to us of importance, and will continue to do so.
Thank you very much. I've got a question for you, Jhonna. Did you worry about losing your job after you blew the whistle? That's part of the question. And were you made aware of your rights as a whistleblower? And there's sort of a third part to that question. How can our community help people like you in your situation?
I was afraid to lose my job. However, when the media started to reach out to me and started to interview me, I realized that I had an extremely fortunate opportunity to speak up for nurses. And it became more about that than about losing my job. I've worked there for almost 8 years. I've never had an issue until this had happened. So it was quite shocking. I actually had a little bit of like a remorse or guiltful feeling that they created, which I now realize was their purpose all along. Looking back, I don't feel like I still don't feel like I did anything wrong. When you're protecting safety of yourself and others and staff, how can that be a bad thing? I still feel like speaking up could get me in quite a bit of trouble. So I do it in different ways now, and I constantly encourage doctors to speak up as well, because there's less repercussion for them. What was the second part of your question? I'm sorry.
Well, the last part was just what can we do as a community to help you in the things that you're trying to accomplish?
That's a good question. Well, to start, we have the petition that we submitted to Attorney General Xavier Becerra, asking him to investigate and take action into the retaliation against HCA Healthcare, in particular against retaliating against whistleblowers. This includes unsafe staffing, rationing of the PPE, and poor COVID-19 infection monitoring. We're currently having to reuse the same gown over and over for different patients. We're wearing one mask for the entire day. They're trying to take away N95s now from us, which is what has been protecting us this whole time. So starting with the petition helps. definitely. And then, just enforcing laws that help protect whistleblowers. I never even really knew what a whistleblower was. I've heard of it, but I didn't have any idea until recently what that even meant and that there were even laws protecting us. I had no idea.
So more education would probably be very useful.
Yeah, also for starters, yes.
Jhonna raises an interesting point when she talked about how the opportunity to actually be public about her whistleblowing gave her a platform that she didn't realize that she might have. And it raises an interesting question about the role of confidentiality in whistleblowing. And I know in the private employment world, it's very unusual that whistleblowers can remain confidential. It's, we advise our clients all the time that, you're going to be known. And so I'd be interested in the response of the government folks about kind of how they see confidentiality playing as a positive and perhaps not always a positive element of how you handle retaliation claims and whistleblowing claims.
Right.
And I'd be curious how often you have people who really insist on remaining anonymous.
I can start with that, Susan. It's a great question, and Jhonna raises some very important and challenging issues that she personally had to go through that I know whistleblowers have to go through. And I do think that it's very important for us as IGs to respect the decision of whistleblowers. The law provides that we maintain confidentiality. We do everything we can as IGs to inform whistleblowers of their rights to confidentiality. Obviously, there are certain legal situations where we can't stop disclosures from occurring if there's a court order or some other situations like that, but we do everything in our power to maintain confidentiality. I think anecdotally, as I sit here, I would say in most instances, whistleblowers prefer to remain anonymous, not have their identities disclosed. And that's precisely for the reasons Jhonna indicated, which is legitimate concern over their jobs, over their careers, over the implications of what will happen to them if information comes out. And, I've spoken before about this as a young prosecutor back in the 1990s, I hate to say it. I did a lot of law enforcement corruption cases in New York City when I was a prosecutor up there for the federal government. And hearing from Mr. Davis and others today talk about the challenges they faced is reminiscent of what I had to deal with police officers who wanted to come forward and report misconduct. If they reported it, if it became public, the Serpico movie, for those who've seen Serpico, wasn't far off. They were risking their lives by doing that. And so there's a very challenging issue for whistleblowers, and we as IGs, and in my case dealing with law enforcement, need to understand and respect those decisions. So we do our best to talk to them about it, but ultimately it's got to be their decision.
Henry, do you have a short remark? We're running to the end of our time.
Yeah, very briefly. So by statute, we do protect whistleblowers. That's required by statute. So we only disclose their identity if they consent to it. That's in the disclosure context. Obviously, for prohibited personnel practices, if there is retaliation, a lot of times we do have, with their permission, obviously, but that's the only way to get a remedy or corrective action in those cases a lot of times. But we do absolutely protect whistleblowers' identity. It's very important.
Thank you. I think it's time for us to bring this panel to a close. I want to thank the panelists who make it ever more clear that now more than ever, each of us owes a debt to the whistleblowers and to those people who protect them, who in these times are challenging the waste, fraud, and abuse that threaten our lives these days and the very fabric of our existence. So thank you very much to our panelists. And now I'm going to turn the podium over to John Kostiak for a panel on a highly significant but newer arena to consider the role of whistleblowers, and that is climate change.